Vaginal discharge is a common occurrence experienced by women throughout their lives. It involves the release of fluid from the vagina and is a normal part of the menstrual cycle, sexual arousal, and various other physiological processes. Understanding vaginal discharge, its types, and its causes can help women maintain their reproductive health and identify when something might be wrong. This article will provide a comprehensive overview of vaginal discharge, including its normal variations, possible causes, and when to seek medical attention. What is vaginal discharge? Vaginal discharge is a fluid produced by glands inside the vagina and cervix. This fluid helps to keep the vagina clean and moist, preventing infection and maintaining a healthy pH balance. The characteristics of vaginal discharge can vary depending on several factors including the phase of the menstrual cycle, hormonal changes, and overall health. Normal vaginal discharge can vary in color, consistency, and amount. It typically falls within the following ranges. Color: normal discharge is usually clear to white. It may sometimes appear slightly yellowish, particularly at the end of the menstrual cycle, but this should not be alarming. Consistency: the consistency of discharge can change throughout the menstrual cycle. It might be thin and watery, especially around ovulation, or thicker and more mucus-like at other times. Amount: the volume of discharge can vary from day to day. On average, women may notice anywhere from a teaspoon to a tablespoon of discharge daily. These variations are generally due to hormonal fluctuations and are considered normal as long as there are no additional symptoms such as itching, burning, or a strong odor. Causes of vaginal discharge: vaginal discharge can be influenced by a number of factors, including hormonal changes, infections, and other medical conditions. Here is a closer look at some of the common causes. 1. Hormonal changes. Hormonal changes throughout the menstrual cycle have a significant impact on the nature of vaginal discharge. Ovulation: during ovulation, the discharge tends to become more abundant, clear, and stretchy, resembling egg whites. This change helps sperm travel through the cervix and into the uterus. Menstruation: before and after menstruation, discharge may appear thicker and more opaque, often with a yellow or light brown tinge as it mixes with menstrual blood. Pregnancy: early pregnancy can increase vaginal discharge due to higher levels of estrogen. This discharge is typically thin, milky, and odorless. 2. Infections. Infections are a common cause of abnormal vaginal discharge. They can be bacterial, fungal, or viral. Bacterial vaginosis (BV). BV is caused by an imbalance in the natural bacteria of the vagina. Symptoms include a thin, grayish-white discharge with a fishy odor. It is often accompanied by itching and irritation. Yeast infections, caused by an overgrowth of Candida fungus. Yeast infections lead to thick, white, and cottage cheese-like discharge. It is usually accompanied by severe itching, redness, and swelling. Sexually transmitted infections. STIs such as chlamydia and gonorrhea can cause abnormal discharge, which may be yellow or green and often comes with other symptoms like pain during intercourse or urination. 3. Pregnancy. During pregnancy, an increase in estrogen levels can lead to an increase in vaginal discharge. This discharge, known as leukorrhea, is typically thin, white, and milky and does not have a strong odor. It helps protect the vaginal environment from infections. 4. Menopause. As women approach menopause, estrogen levels decline, which can lead to drier vaginal tissues and potentially less discharge. However, some women may still experience a discharge that is less frequent but thicker and less clear. 5. Certain medications. Hormonal treatments, such as birth control pills or hormone replacement therapy, can affect vaginal discharge. These medications can either increase or decrease the amount and change the consistency of discharge depending on the type of hormone and dosage. When to seek medical attention. While many changes in vaginal discharge are normal and related to natural bodily functions, certain signs can indicate a need for medical evaluation. Abnormal color or odor, discharge that is green, yellow, or gray, especially with a foul smell, may suggest an infection. Unusual consistency, discharge that is unusually thick, clumpy, or frothy could indicate a yeast infection or other issues. Accompanying symptoms, if discharge is accompanied by itching, burning, redness, or swelling, it may be a sign of an infection or another medical condition. Persistent changes, any significant or persistent changes in discharge that do not correlate with normal menstrual cycle variations or pregnancy should be discussed with a healthcare provider. Conclusion: vaginal discharge is a natural and essential part of female reproductive health. Its characteristics can vary based on hormonal changes, infections, pregnancy, and other factors. Understanding what is considered normal can help women identify potential issues and seek appropriate medical care when necessary. Regular gynecological checkups and open communication with healthcare providers can aid in maintaining vaginal health and addressing any concerns that arise. If you have any doubts or experience symptoms outside the range of normal, consulting with a healthcare professional is the best course of action.